Good morning, everyone. I am Jan Blanchard. I am with the Pediatric Solutions team here at PCC, and I have the honor of introducing our speaker for this morning. In just a short while, Jeffrey Degrapont of the Coker Group will be giving his talk, The Transformation of Healthcare Through Artificial Intelligence.
Well, let me start by saying thank you for the honor and privilege to present. I wish we could do this in person. Just to show you what I have to deal with Chip Hart, when he asked me to do this presentation, he insisted that I use this background, but I thought, appreciate everyone joining today. Let me share my screen here, and we'll jump right into the presentation. I always like to tell people that, my only disclaimer is we don't have any financial ties or affiliations with any vendors, so we're an objective third party. We've always been very honored and privileged to have the opportunity to interact with the PCC user conferences, and we share a number of mutual clients together, so that's always been a really great experience for us. So today we're going to be covering the topic of artificial intelligence, and got some really interesting, thought-provoking questions for everyone. So towards the end, I'd be very interested in hearing some of your comments and concerns. We'll even cover some of the ethical concerns that we are now starting to see with artificial, including things like what happens when it becomes biased or starts acting incorrectly. So we'll cover that. So just as a kind of a housekeeping, this is the agenda. We'll cover what the definitions a little bit, a little brief history, and then I'll transition to exactly how it's being used in healthcare and give you some examples, and then we'll wrap up with some of the ethical and legal concerns, and then what are some strategies to adopt it if you're interested. So I think the first thing to do is kind of define what exactly is intelligence, right? I mean, I don't know as if this is pretty self-explanatory stuff, but it's basically the ability to acquire and apply the knowledge and the skills, and then the ability to interact. So things like our speech, our vision, our motion, how we might manipulate certain, decisions in certain situations, and, the ability to reason, which is sometimes a challenge for some people. I know myself, sometimes my wife will say that. And then, of course, can, we learn and adapt, and then, of course, think in an abstract kind of way and think objectively. Those are kind of what we define as being intelligent. And the question now becomes, can a computer act in this way and perform much like we do as humans? I mean, the brain is pretty complex, so that's a pretty significant task there. And now, when you get into the artificial intelligence definitions, there's really sort of only two methods. Oftentimes the term artificial intelligence or AI is kind of the umbrella term for all things that is a machine of some sort carrying out a task or an activity or a decision. But there's really only two real, developed methods in the market. There's what's called machine learning and deep learning. Machine learning, more times than not, is basic if and do what type algorithms, where based on the information you feed it and based on the next logical response, it will then perform accordingly. So an example of that is if you decide, if it asks you, do you smoke? If you say no, then that's the end of the algorithm for that train of thought. If you say yes, then of course the algorithm then kicks in. Well, how often? How long? How much? It might ask you additional questions about sensation. When do you have the urge to smoke, or things of that sort. Additional questions will narrow it down even further. So it's kind of an if and do what. Again, not to oversimplify it, but that's essentially what machine learning is. The deep learning, on the other hand, is when the machine is capable of evolving based on its own feedback from the outcomes over a period of time. And the concern with deep learning is what happens if it evolves incorrectly. I'll give you a great example of where it was a terrible example of deep learning behaving incorrectly. There was some AI technology developed for our legal system that judges were using to sentence criminals. And for whatever reason, this AI software had discovered that people born in October were more likely to be repeat criminals. No logic, no rationale behind it. It just that data set sample. And the way the AI technology will work is if you had a higher chance of becoming a repeat offender, then the judges were issuing more harsher sentences. And so can you imagine if you're the poor kid that just got, busted for recreational, marijuana, first time offense, but his other offense was he was born in October and got a harsher sentence as a result of that. So sometimes AI can it's called deep learning, but it can also go off the deep end and cause problems. So it's not entirely perfect. And that's a great example of where, as we get into this, we really have to have the proper checks and balances to make sure that we're not making decisions, especially clinical decisions, off of data that may not be very germane at all to the outcome. And so one of the indicators that you can certainly look at to determine how AI has influenced the market is just simply look at the numbers, right? I mean, look at the number of startups that has just exploded into the scene. You'll see some more examples of this later in the talk. As far as the investing, 6x, I mean, that's huge. In fact, many experts predict this will be significantly larger than all things that we've seen up to this point because it has pretty far-reaching potential and possibilities. If you look at the type of jobs and where people are hiring, there's a significant increase in activity of companies looking for programmers and people that have this skill set. I'm going to get into this in a second, but one of the bigger concerns or significant concerns is, will AI make income inequality worse? And the reason why that's a serious concern is that more times than not, AI typically replaces the lower skilled labor, and unfortunately, that's not always a good thing. Also, if you look at how revenue is generated, it's also substantially increasing, and you don't need me to tell you, but follow the money, right? That's where the markets typically go, where the investors, where the VCs, where the vendors are going to respond to is where the investment's being made. So again, a pretty significant jump from about 1.6 billion to now 31 billion, or projected to be 31 billion by 2025. So pretty significant jump there. Now, if we start looking at sort of our history in AI, this isn't necessarily anything new. In fact, you guys probably remember that little paperclip that used to tap on your screen, that little Windows guy that would annoy you every time you made a mistake. Well, now the computers just simply assume you don't know how to spell, and it corrects the word for you through autocorrect. But that was probably one of the first examples that I remember, looking back in history. Another great example of where it really took sort of national attention was when the IBM Deep Blue chess machine defeated at the time the world champion of chess. And if you've ever played chess or you know how to play chess, that is something that requires multiple layers of thinking, strategy. You have to be 4 or 5 moves deep in your thought process, and that's quite remarkable that a computer was able to accomplish that. Some other stats that I think are of interest, and you guys can probably relate to this. I know I'm so impressed with how good Netflix has become at figuring out exactly what I like to watch. I mean, they have me down to a T. They have identified, all my interests, and of course, it's largely due to my past history. But they are also ingesting a lot of other information. You may not know this, but there are companies that do nothing but track data on us. In fact, there's a company called Lexis that has over 5,000 data elements on most everyone in the United States. Everything from your purchases to your political affiliations to your religious affiliations, where you spend your money. Are you a impulse buyer? That's where you're starting to see a lot of the marketing activities targeting us as it relates to our interests and profiling. So I'm not going to go back to the beginning because I don't think it was all that relevant. But here's where I was showing you the little paperclip guy. So I actually had a picture of him. So all right, well, good timing, and thank you for making me aware of that, because we're really now transitioning to examples of AI in healthcare, which I think is really more of the germane topic that we're here today to discuss. So the question becomes, are we comfortable with this, right? Can machines take the place. I don't think it ever will, but would we be comfortable allowing it to support us, to use it? I think there's definitely some benefits. I also think there's concerns. As a consumer of healthcare, and I assume you would agree with this, I think this is a very reasonable expectation. I think that our health systems, in fact, I think any company that we do business with should at least at a minimum give us some sort of notification and the opportunity to consent to opt out or participate. For example, you'll see in a second, one of the evolving AI platforms today is listening devices in your exam room. How about that? What do you think about that? Maybe as a caregiver, might not be so bad, but as a consumer, as a patient, would you want to know there was a device in there listening to that conversation? And why would it be listening to the conversation? Well, maybe it's picking up on things that the provider may not be aware of. For example, if get asked the question, are you on blood thinner? You'd be surprised how many patients say, no, I don't take blood thinner, but they might take fish oil, which is a form of blood thinner. And that AI machine may already have all that 5,000 data element points and knows that you've been ordering fish oil from Amazon because they buy Amazon data. And so that would then alert the caregiver to the potential risk there. So if you look at sort of where we're at, the main drive, at least in AI technology today, is there's been a lot of emphasis, and we're going to see a lot more. I think if you are looking for an area to invest in, is the AI technology that can reduce infections. Obviously with COVID, this has brought this to the forefront in a very, very big way. What type of methods? And here's an example of a sensor that can tell if a caregiver has moved into a second patient zone without going past a hygiene station and actually activating the hygiene station. And so one of the leading causes of death in the United States is that many people every year go into a hospital as healthy people and they never come out because they get infections. In fact, that's probably the most terrifying thing that I personally have about hospitals and why I don't enjoy going around them, but it's a big problem. In fact, I think the last stat I saw was 100,000 people a year die from just hospital-acquired infections. To put that in perspective, that would be equivalent of a 747 crashing every single day. That's a lot of people. So a lot of emphasis on the AI hygiene. Also, very common nowadays, we're seeing these virtual assistants show up. And virtual assistants can be, through various methods. It can be through web portals. It could be avatars of some type. These are oftentimes computers that can interact with your patients, give directions. In fact, there's one called Pepper, which is out of Belgium, and this little droid roams around the hospital and greets patients. It gives them directions to the cafeteria. It can interact. It can also detect if a person is sad and try to cheer up the patient. So it can even recognize some emotions, which is kind of interesting. In fact, I don't think I have an example of this, but one AI company that we've been working with out of the UK called Babylon, which is attempting to deliver telemedicine vis-a-vis a chatbot, is that the chatbot or the phone system can detect stress in a patient's voice and can even determine the level of severity and the urgency based on voice sensing technology. So, pretty interesting. They've also tied back to the Apple Watch for behavioral health, and that Apple Watch can call back home if that patient hasn't left the house in, say, 2 or 3 days. Then a social worker can go out and check on the patient. So you're starting to see a lot of this integration kind of all tie together. I think these droids are quite fascinating. Another example is where this gets a little bit controversial is whether or not the AI should be making clinical diagnoses. And in fact, there's one that's already been FDA approved, and it was for retina testing. And surprisingly, the ophthalmologists didn't freak out about this, maybe because they didn't feel like this testing was a significant threat to their revenue, or maybe they felt like, hey, the computer already does most of the diagnostic testing, and supposedly the results are outperforming what doctors typically pick up on and catch because it's able to analyze it so much closer and more consistently. But it is controversial in that this is the first example of a machine actually making a diagnosis, and it's been FDA approved. So, where do we go from here? Another example, and I don't really consider this AI, but you guys have probably heard of some of the robot-assisted surgery. And while this isn't AI in the traditional sense, these tools do have a lot of AI around knowing when you back off of pressure, what you cut, what you don't cut. Some of these tools can detect, the difference between bone versus skin. It's amazing how microscopic some of the surgery can be done now, whereas in the past we would be cracking open chest and whatnot. So now they can just go in right between the rib bone and perform major surgery. So very impressive. This gets back to the AI-powered EHRs. Now, I will say, and this is one of the areas where PCC has always led in the market, they built technology to anticipate how a doctor will typically respond and react at the point of care. So their tools are already very powerful. The question is, how much intervention beyond that will doctors and caregivers tolerate? Do you want the EMR continuously popping back with, recommendations and suggestions, maybe overriding certain things, the listing example that I gave you a second ago? I think some doctors might be comfortable with it, but then I also think a lot of caregivers might find that to be very annoying. Where I think it's very helpful is that if your EHR has intelligence that can tell you when they know your documentation isn't going to pass, and they know that code isn't going to be approved, or they know that test is not covered by that patient's insurance, and they can give you point-of-care feedback so that way you can self-correct that at the time of care, at the time of service, so that you avoid the rejections and the problems later. We've already seen some of this in things like drug-drug interaction, Sure Scripts, other tools that give you some limited feedback, but it's largely been predicated on whatever we build and whatever we customize within our own environment. But I think you're going to see companies like PCC really, lead the way in enhancing their EHRs to have more built-in intelligence, and I'm very much looking forward to seeing that. AI-powered collections. This gets a little controversial also. I mean, what do you guys, or how do you guys feel about technology that could go in, look at every single patient in your database, and can tell you with a high degree of certainty what is the propensity of that patient to pay or not pay? And if you knew that information, would we treat those patients differently? Should we flag those patients, for example? And the reason why that is of interest to a lot of people is that when you have patients, especially those that go into collections, we tend to spend an exhaustive amount of time and effort making the same amount of effort regardless of the likelihood of the person's ability to pay or propensity to pay, when there's probably only about 10 to 20% that we really need to be concerned about. The other 80% might just be slow pay, or they'll pay versus different tactics that aren't as labor intensive. And so should we, profile patients in this way? I don't know. I mean, I could see where if it might be helpful to have it, but I could also see where if we treat people differently as a result of it, that could cause us some problems, and we certainly don't want that. Another example that is very common these days, if you are in IT support, we do a lot of this for PCC today, and we're really looking into self-healing type technology that can go hunting for threats, proactively hunting, seeking and destroying. We don't want to wait until something shows up. We want to proactively go look for it ourselves and hunt it down. What about, self-help chat box that can manage through simple, consistent type issues that commonly come up over and over again? And just to give you an illustration of a Helpdesk chat box, I actually have the diagram of a single, end user call, and this is what the script would look like. So you got an incoming call, this first green dot, and depending on what your issue is, it then follows a series of algorithms to lead you to hopefully correcting the issue. And if you've ever been on the other end of a computer problem, waiting on an IT tech to call you back while you're sitting there with your patient, there's probably nothing more annoying than that. So there's a lot of interest right now in figuring out, can we get chatbots to handle a lot of IT issues when the caller first comes in. Now, this could be just as annoying if this chatbot takes you on a wild goose chase and ends up telling you to go unplug the coffee maker by the time you get to the end. Or it just says, is your computer plugged in? You know, that's probably the first question, this red dot, is it plugged in? Then this dot is probably, is it turned on? And this dot is, did you log in correctly? And then here we go, we probably get another dot that says, okay, reboot your computer, you know, and then go back to the first dot. So I could see where also, if this isn't designed very well, it could get annoying very, very quickly. So, but this is the basic chatbot logic of AI for an IT help desk. Now, this one's interesting. I'm intrigued by the facial recognition for two reasons. One is the libertarian in me feels like it's a total invasion of privacy, and I don't feel like companies should just do this without giving some consent that they have this technology in place. So an example of this is, you walk into a hotel, they pick up your face with their sensors, and based on your image, they already know everything about you. Are you a big tipper, a big spender? Do you like, you know, early checkouts? Do you like to stay late? You know, how much where did you shop at last time you were here? You know, all this information that's really personal that you may not want to share with somebody that can start profiling you, or maybe even treating you a little bit different based on some of the other things they may know. What about your political affiliation? What about your, you know, how do you identify? Those things like that are personal, that you have to make the decision whether or not you share. It shouldn't be able to somebody just simply randomly take it from you because they have the data. Now let me flip the coin. What if the same type of technology could pick up a known terrorist walking into the hotel with a backpack filled with explosives? Would we not want to know that? So, you know, I think there's some benefits here. You know, there's talking now about temperature sensors that can monitor large groups of people as we walk into, you know, stadiums and concerts, and they pick out whoever has a temperature so that we're not spreading COVID. You know, those kind of things are now being discussed, and again, it's a little bit unknown, but this is out there. Do you guys remember that Face app that everybody was uploading? Well, those companies were really capturing your images. I mean, it was a cool app, and everybody enjoyed it. It spread over Facebook for months. I got annoyed by it, but that was a tactic to go grab facial images. Have you ever uploaded a picture to Facebook and it automatically knows who you are and starts tagging you? Or worse, you upload a picture of your parents and it tries to tag you as your mother or your father. Talk about you know, really feeling old, or you know, you're just like your father kind of feeling because it resembles the same image and it assumes that could be you. I don't know if anyone's experienced that. I had it happen to me the other day when I put a picture of my dad on Facebook and it tried to make it, you know, tag me as the picture. All right, now let me jump into these legal concerns or ethical concerns. We talked already about some examples of what happens when AI becomes biased. And if you think this is sort of a, you know, not an issue, go Google Microsoft Tay and see the absurdity that thing went off on a rant. I won't repeat what it said, but it was pretty offensive. And eventually Microsoft had to pull it off the internet because it got so offensive. What happens about the inequality? This one worries me a good bit because we are going to see a significant shift in how we distribute jobs, opportunities, and wealth. And, you know, this raises another concern. Who should benefit? Is it the developer? Is it the owner? Is it the buyer? I mean, obviously, as caregivers, if we adopted and replaced our IT, you know, companies with chatbots, then we could save money. But, you know, at the same time, you might have eliminated several jobs that are now going to have to either get retrained or retooled. Again, you know, we've seen this in other areas. We've seen it with the ATM machine. We probably saw it all the way back with the horse and buggy. So it's constantly an evolving challenge. But where AI is concerning is that right now, if you look at all the types of technology that's out there, or at least the focus, it all seems to be focused in on the lower skilled jobs. Go to any grocery store and you won't find checkout people. McDonald's is now testing entire restaurants that are fully automated, where you order with a kiosk and the computers make everything. In fact, I was in Las Vegas a few years ago, and there's a robot bartender now that can make you any cocktail you want, and there's nobody manning the bar. I mean, it just happens. So we're going to see more of this, and like I said, unfortunately, it will probably hurt our lower skilled workers the most. What happens when AI becomes evil? It cures all the cancer by just simply killing off the humans. I don't know of any real examples of it, but there's those that are concerned. One of the things that I didn't mention earlier that's an important point. Most AI developers do cap off the machine's ability to evolve. So it's closed. Basically, it's only designed to perform that function. The ones that you see in the movies and you hear about that people get concerned about is what happens when the AI begins to adapt emotions and feelings, and which actually takes me to the next bullet. Should AI have rights, or can something that's not a human have a right? I mean, we give rights to our animals, right? And our humans, well, you might say, well, that's a living thing. Okay, well, we give rights to corporations. So will AI have rights, especially if it evolves into some, what happens if the AI evolves to its own unique intellectual property? Who owns that? Does the machine own it? Does the original developer own it? Does the user that purchased it own it? So a lot of these questions are going to have to be answered. And then how does this affect our behavior as humans? I'm already concerned when I look at our younger generations losing their ability with their social skills because we don't just get out and interact like we used to. I think there's a lot of good positive benefits with social media, but I also think it's hurt us in a lot of ways because, if you see tables of kids or even families, they're not talking to each other anymore. Everybody has their head down in their cell phone. They're texting other people when they're sitting there with their friends. So, there's always the concern about what kind of impact will this have on our social fabric as a country. And then, what happens if it causes harm? Or let me go back to the next one. Who owns the IP? That's the intellectual property. That's another big concern. And then what happens if a patient is harmed as a result of this? And then, you want to make sure that obviously if you do adopt AI, that you are very careful to make sure that it doesn't have any inherent biases in it. And that's something that I don't quite know the answer to tell you how you would go and vet that out ahead of time, but sometimes biases can show up from whoever the developer was because they had a certain feeling towards a certain way, and so just want to be careful and watch for that. And then of course security, that's always going to be concerned. And then I do think that you need to set expectations that there are limitations to everything. All right, so if you were to start looking at how you would adopt AI, let me do a quick time check here. Okay, I see the time now. The first thing that I think you'd want to look at is, what's an acceptable level of participation and what are you trying to solve? I mean, the worst thing you can do is this is the next new shiny thing, so we go jump out and start adopting and purchasing and contracting and getting ourselves financially committed to things that may not even have any real relevance or any value, but it sounds cool, so we're going to do it. So, make sure that you understand what data do you even have available today? You're going to be very disappointed in any AI if you don't have good data to feed it and the capabilities to provide a source of truth and good quality information. There's probably going to be missing data streams that you might even have to proactively start building and compiling. And then obviously, again, recognize that there are those limitations. The other barriers that I think that you have to accept and acknowledge is that, does the organization even accept it based on some of the concerns we've already talked about? I mean, will our patients accept it? The truth is probably around us more often than we realize. Have you ever had this happen to you? You're just randomly at home and your phone tells you that if you don't leave the house right now, you'll be late to your meeting? I mean, it knows that you're going to, and it already knows what the traffic is. It tells you the traffic's light, you can leave at 3:30 and you'll be fine. Well, how does it know that? How does it know where you're going? Well, we sometimes forget that in order to get the benefits of the technology, there's a trade-off, right? If you want to know where the nearest Starbucks is, you have to let the app know where you're standing and where you're traveling. Who here has ever received a strange notice or an ad after you had a conversation. Some people think that's crazy talk that our phones listen to us. I probably wasn't COVID, but last year I had the worst cough. I mean, this cough was lasting forever, and I was hacking up everywhere. I kid you not, I got a NyQuil ad, like a NyQuil cough ad at that. And I never searched for NyQuil. I had no interest in doing any, I can understand if you did research and Google searches, that I get that because the internet knows that you look for certain things and it will come back with you and hit you with ads. But the NyQuil and me coughing, I've had ads show up while I was standing in the middle of Home Depot looking for a faucet, and an ad for a faucet at Home Depot shows up. Now, how did that happen? Well, that one's easy. I probably had my location beacon on, and I was telling the world where I was standing, and I had been doing research on faucets. So the internet was smart enough to connect the dots, and some smart marketing person said, hey, let's target this guy with an ad. He's about to buy something. Now's the time to hit him up. So again, I think you sort of have to have kind of those questions about where's your level of comfort before you even start going down this path if you're comfortable with it. And then where would you start? I think the first thing is, obviously, as I said a second ago, it's not something you rush into. Continue to do research, create awareness. If you are interested, you're probably going to have to do a little bit of changing the mindset a little bit, maybe getting people to have an open mind to it. I always recommend to start with very, very low expectations so you don't overpromise. Maybe identify some easier things that you can accomplish to prove concept. I would say that, embrace technology like PCC. Even though I have cloud computing there, I want to clarify that in the PCC model, you have a very strong IT ecosystem, far more superior than what we've seen. And I say that as an objective third party. We deal with dumpster fires all across the country, and we just don't typically see any. In fact, I've never seen it. I've tried to find them, but it just doesn't exist. So that IT environment is very, very strong. Certainly work groups can help you. Now, one thing I will say about cloud as it relates to AI, a lot of this technology is being developed in the cloud and will work with companies to ingest the data from your source. So that's a pretty common trend as well that we're seeing. And then what type of gaps that you might currently have. And then, of course, it may be wise to enlist third-party experts to help you transfer the knowledge or give you some guidance. And then this is where it gets a little overwhelming. Obviously, there's thousands of vendors that are already rushing into the market with various solutions. I would say this, no matter what the vendor, make sure you understand the contract, especially with AI more than anything, because you will probably evolve the technology. You may want to be entitled to some of the rights of whatever you evolve and solve. I also think because a lot of this is unproven, it probably would be wise to make sure that you have your financial commitments tied to the accomplishments or the outcome. Unlike, PCC, for example, I'll use them as another example. They've been around for years. You don't have to question whether or not they're capable. We know they're capable, but anytime you're going into a new market, unexplored, uncharted, then there is some risk of those unknowns, and that's where a good contract can help you minimize your risk as an individual. So things like having a good scope of work, acceptance criteria, making sure you get good payment terms so that way you're not committed to something until it works as promised. And as we've always done and always offered, because we just, we're very concerned that people oftentimes make decisions like this without any outside input. There's never a cost, never, ever a cost for us to review your contract. You can send us any contract, we'll look at it for you and give you some feedback, and always happy to do that for anyone. Short term, look at your current capabilities, maybe middle of the road, test out a few concepts without getting too crazy. And then long term, look to, where you want to go as an organization. And, maybe you're not ready today, but you could start preparing what kind of data you're collecting, what kind of problems you want to solve, and certainly begin preparing and planning accordingly. Here's a couple of great examples of health systems. These are obviously larger, and that's not uncommon right now. You're going to see the bigger health systems make the investment and then eventually come down to others. There was, I think it's I don't have it on here. There's a hospital system out of North Carolina that's now delivering all of their medical and office supplies with drones. So a drone, you need a box of staples, the drone comes in. There's no more couriers on the campus. These drones go into a warehouse. They pick up whatever you order online, and it flies back to you and drops off your box of gloves. It drops off your erasers, your pencils, whatever you need. And that's an example of what I was saying a second ago. I mean, now we have probably, couriers that are, out of work because the drone is now doing their deliveries. But it is what it is. But that's, I don't know. I guess it's one of those things we just have to begin adjusting to if we see more of that. I'm excited to see a drone come to my house and deliver me an Amazon package, but we'll see. All right, so I'm going to leave you this with final thought, then we'll open up for some Q&A. I can't see your hands, but I usually ask how many people are familiar with the book, The Black Swan? So it's a great book. The concept and the narrative of the book, The Black Swan, analyzes devastating consequences that can happen to organizations and companies simply by just not preparing or not being aware of the environment around us. So, for example, a classic one that's a casebook study, the Kodak Corporation, right? A global billion-dollar, world-renowned company, overnight is wiped off, the business scene. What happened to them? Well, digital cameras. Not one person at Kodak saw that coming, not one. Well, in fact, one did. It was a young engineer that brought a digital printer to the board, and they freaked out on this kid. They said, well, who knows about this? You realize that people will go into burning homes to get pictures. Why would anybody ever, take digital pictures or want to print their own? That's what we do. We sell ink, we sell pictures. And no one's going to ever, store their pictures online. Well, unfortunately, that's where we are, right? I have two daughters. One is 25 and one's 10. And a big difference there, I realize. Just took a break. And the 25-year-old, we have tons of pictures, boxes and boxes of pictures. The 10-year-old, none, not so much. I mean, we have a few, but very, very few. But thankfully, they both look almost identical when they were the same age as younger. And so we just tell the younger one that's her picture. So we get away with it that way. That's joking. All right. So back to the book and kind of my takeaway here. So one of the other examples in the book that I love to give this at healthcare conferences is they analyze the food consumption over the lifespan of an animal. And basically, as it shows in this graph, is that the longer the animal lived, the more food the animal was consuming. However, there were devastating consequences coming to this animal, and it was this right here. Now, shouldn't this turkey have known they're getting free food, they're gaining weight, their friends are leaving, not coming back, there's all this screaming in the background, but yet this is how they ended up. And this shouldn't have been a surprise to the turkey, right? Just like all the other things we're hearing around us should not be a surprise. You guys as leaders, you're some of the top practices in the United States. You've been out in front, you've adopted, you've made the investments, you have a lot of things to be proud of, and the next generation of leaders will be looking to you to set this example of where we go next. And I think, in my personal opinion, while I know I brought up a lot of pros and cons and even some controversial things today, I do think AI is going to be the next, era of automation and innovation that we'll start to see show up more and more in our lives. And if you want to learn more about AI, I do have a few resources that you're welcome to go to on your own. Great information out there about the different development and where things are at in the market of AI. And then, of course, you're always welcome to contact us. And again, if you need help looking at a contract, certainly take us up on that offer. I always enjoy doing that. No problem at all. So, Jan, I think I left about 15 minutes for Q&A if there's any questions. If not, I can give a couple more tips to the audience.
Yeah, we don't have any specific questions that have been asked. We did, but we know people are listening. There were at least 2 people that had voted. We threw a quick poll in to see how many folks were familiar with the Black Swan, and we got 2 familiars. So I know people are listening and they're engaged. No specific questions, but my gosh, I'm blown away by some of the things that you shared. I can't wait for the day that Facebook tags me as my mom, but and I hope it's my mom.
Yes, for sure.
Well, yeah, I wonder. Go ahead.
No, I was just going to say real quick. I think most everyone, like I said, they're probably interacting with some AI today. In fact, one of the stats showed that 40% of the time we're already using some form of AI and may not even be aware of it. I will tell you, when you call like American Express or Delta or big call centers, you're more times than not going to have an interaction first with a chatbot. In fact, some of those chatbots have gotten very, very good. I'll be, 2, 3, 5 minutes into the conversation before I realize I'm talking to a computer or a robot. And then I start just hitting 0 to try to get out of it. But, so we're seeing it there. I think on the consumer side, as it relates to healthcare, I think our patients will embrace it. But I think in fairness to our patients, we owe them a notice, right? We should have some consent that, hey, this technology exists. There's the movement of the right to be forgotten. So I don't know if people have heard about that movement. That is your right as a consumer to completely delete yourself from the internet. Impossible to do, at least I think it is, but there are some movements today to try to pass that. And then I think there's going to be certain data elements that unfortunately there's just no way that you can avoid it. It's just part of life, and it's going to be out there.
Yeah. Your description of that Pepper device specifically reminded me when you said you press 0 to get out of those chatbots when you call customer service. That tone of voice stuff sounds pretty sophisticated to me, and it reminded me of some of the experiences that friends have had. If you sound angry when you're asking for a customer service rep in some of those voice prompts, they are pretty responsive. So all that groundwork is laid years ago, and now it's being used maybe for good.
Well, here's another big, huge benefit to the listening device that I didn't mention. I mean, how many times have you had the most irate patient call the office complaining about something that a staff member did? And in cases where it's happened over the phone, a lot of practices do record all phone calls. In fact, if you're not doing that now, I would strongly recommend that you go and record your phone calls of your staff, because you'd be surprised when you go back and listen that the staff member was actually very, very polite, very cordial, was very helpful. But the patient has learned that if they scream loud enough, or they blame other people, or they say things, then it's going to invoke the natural reaction that the customer is always right. And sometimes we don't have the complete picture. It's just one side versus the other. You'd be surprised. Second, our caregivers give patients very good and comprehensive instructions on what to do, and they don't always follow those instructions. So from a liability or a malpractice standpoint, it might be very helpful to be able to go back and say, no, we not only did we document it, you can hear the conversation for yourself. We did, in fact, instruct the patient accordingly, and they just didn't follow orders. So from a liability standpoint, there could be some advantages. Again, if you're giving consent, if you ever notice that when you pick up a phone and the first thing you hear is this phone call may be recorded for quality control, that's your notice. And so, that's how to get around with it. Or if you walk into a business, this building is under surveillance. And that's, the lawyers will tell you oftentimes that was an attorney that suggested that they put up that sign. So that way, if you were filmed doing something, there was a lady that fell in a fountain in a mall, and it was funny. It got on social media and everybody shared it. Well, now she's suing the mall because that was an embarrassing event. So, because she didn't, her argument is she didn't ever give her consent to be filmed, and certainly didn't give her consent to be shared on the internet. But so there's little things like that we're going to have to worry about when it comes to notices and consents. But I lean on the side of give consent, give transparency, tell people what you're doing. I would hate to be, recorded in an exam room and not be told it was happening as a patient.
Yeah. Well, and that vendor list that you shared is unbelievable. That is a huge number of lists. Those contract services, the contract review services you guys offer must be super helpful for those considerations. Are there any things that stand out to you in recent memory of things that you've caught in contracts that just blew your mind, or that you were particularly grateful to have spotted beforehand without naming names?
I think I'm always honored when we have vendors like PCC that can sort of set the example of what a friendly vendor is, not one that's predatory. The worst thing that we're seeing right now is that there are vendors that are literally holding doctors' data hostage. I mean, like ransom, and they're asking them for $10, $20, $30, $50,000 to hand their data back. And I mean, it's just it's awful. I mean, it's a patient safety issue. It should be criminal. Now, there is some legislation around data blocking and trying to prevent that, but you'd be surprised at how many of your competitors do keep doctors' data unless they pay them an exorbitant amount of money. Now, you can fix that because a contract could easily state that upon termination, you get the data back, no questions asked. And they'll all tell you they'll give it back to you, but it's with a heavy payment, or they make it very difficult to get it back. We've been very successful. I won't name names, but if you are listening and you have any vendor blocking you from getting your data, I want to know about that, and we will get you connected with the right people that can get you back your data, and it probably won't cost you anything. We've been successful working around those challenges. So don't let anybody, bully you into paying an absorbent amount of money for what is rightfully yours. You should not have to do that.
I love the sound of that. Thank you so much, Jeffrey. This has really been an education. I really appreciate your time, and I hope folks will watch the video. And if anybody has any questions, please feel free. We'll stay in touch with Jeffrey and with Coker. They have a channel right here in our exhibitor hall. So if you want to ask those questions directly, please go for it. Go straight to the Coker Group channel. And with that, I'm going to double check, be sure we haven't got any questions since, and there's not anything new. So thank you again for being here, and I look forward to seeing you all again soon. Thank you, Jeffrey.
Take care. Thank you.